Good afternoon, Your Excellencies. Good afternoon, fellow Africans and friends of Africa. My name is Brian Tamuka Kagoro. I will be one of your two hosts this afternoon. But before we start, I have a few housekeeping announcements. I'd like you to pay attention to the screen for the housekeeping announcements. I'd like to kindly request that you keep your microphones muted at all times. This helps with minimizing distortions. Second, we will have simultaneous interpretation in English and French. In order to access the interpretation services, go to the interpretation icon on your screen to the bottom of the menu bar, select your language on that icon, and then mute the other language. So that if you select French, mute English, but stick to your selected language choice throughout the dialogue. And if you wish to make any comments during the course of the dialogue, kindly post your question by putting it in the chat. Let me just give a little bit of background to why we are here today. There is a realization that COVID-19 presents an opportunity for Africa and Africans to coordinate better in finding and surfacing and applying effectively resourcing solutions for the transformation of Africa. But these solutions ought to be homegrown. We have seen with the advent of COVID, youth, innovators, entrepreneurs, African think tanks, civil society, faith groups, traditional leaders reacting, responding, and creating solutions. And some of these solutions, some of you on this call are part of them. But COVID has also thrown and surfaced the deepest of hopes and of fears amongst Africans. We know for certain that public health is critical to Africa's transformation and sustainable development as envisaged in Agenda 2063. And our experience shows that pandemics such as HIV and AIDS, Ebola, and coronavirus show up weaknesses in our policies, weaknesses in our development paradigm, but also become or constitute a clarion call to action. And we, as members of the LEVI group or initiative, have convened this with the kind technical facilitation of UNDP. I am a co-chairperson of a working group within LEVI called Public Goods, Resources and Leadership. My co-chair is Auna Eziakonwa from the UNDP Regional Bureau for Africa. You will hear from her later on. And what we want to do this morning, allow me to introduce to you my co-moderator. But before I do that, but just to emphasize 4 things. Number 1, we are focusing on solutions because we know that solutions exist within and across Africa, within African states and beyond African states, amongst Africans who are in the public sector and ordinary citizens. We've also seen globally that the pandemic has particular gender and class dimensions. It has a disproportionate impact on different segments of the population. So we want to engage in a conversation not for the sake of conversation, a conversation that will systematically identify and develop, resource, and scale up solutions for our collective good. You may be wondering, I keep talking about LEVI. This is not a reference to an American pair of jeans. LEVI is a very important initiative on the continent that has a cross-section of multidisciplinary actors drawn from the state, drawn from private sector, African academy, and also African entrepreneurs and others. I will call upon Paul Paul Okumu will explain what LEVI is about. He has a few minutes, then I'll come back to the promise I've made you to introduce my facilitator, who will then lead us into the panel discussion. Paul, you have 2 or so minutes to explain LEVI.
Okay, thank you very much. And I sincerely, are you able to hear me very well, Brian?
You are louder and clearer than I was.
Okay, all right. So you're going to become my SI unit, as we used to call it. And thank you very much. I would want to welcome all of us and sincerely appreciate this opportunity. As I just want to give you a very quick background. About 18 months ago, the World Economic Forum set up an advisory team for the African region. And part of what we were required to do was to deliver something that we thought would be good for the continent and would be good in transforming both the public, the political, and the social sector. And what the team did after about 18 months of work was we then agreed that fundamental to the future and to the current state of the Africa continent was not just about leadership, because Africa has got probably some of the most competent leadership of anywhere. But we felt that we needed to frame leadership around values, we needed to frame leadership around ethics, we needed to frame leadership about principles, things that we on the African continent fully identify with very well. And so that gave birth to the LEVI, which is looking at purely what kind of values, what kind of ethics, what kind of principles, what kind of cultures, what really needs to inform the kind of leadership that whatever that we want, not just for ourselves in terms of public sector leaders and those of us who are in the social sector, but in terms of the kind of social contract that will move the continent forward. And so it's extremely exciting to begin this series of dialogues today. LEVI is focusing primarily on 4 areas. So there is the Laurel Society, which is looking at values, ethics, and trying to see whether we can rally around public sector and another leaders around a specific set of values. Then we have got the next generation of leaders, which is looking at the African continent and looking at its generation. We have got a segment that is looking at how to build up the women leaders. And many of us have seen over the last 2 months, COVID has actually brought us a perspective in female leadership that we need to learn a lot from as the African continent. And then we have got an element of looking at what technology means in terms of leadership, ethics, and values. So that's the broad context of what LEVI is focused on. What we are having today is what I want to call a repurposed LEVI. We call it a repurposed LEVI because COVID, pandemic has provided for us some great opportunities to try and see what we can shape on the African continent. So the world has been waiting for the continent to implode. They waited for the first week, the second week. 2 months down the line, the continent is still standing. And for us, that's an indication that there is an opportunity, not just amongst us as citizens, but amongst our own leadership to rethink the way that we do things in terms of values and principles. And it's extremely exciting that we have got this opportunity to see what we are able to build out of this. So that's the background, and I'll bring it back to you, Brian.
Thank you, Paul. And let me just remind you what this is the first in a series of 3, what our expected outcome would be after all this public conversation. It's an awakening of an invest in the people, transformative leadership, and capable institutions ideology, an identification of African strengths, African ideas, and African resources for Africa's transformation. My co-moderator who will lead the panel discussion is Dr. Joy Kategekwa, who is the strategic advisor to the Assistant Administrator and Director of the UNDP Regional Bureau for Africa. Joy holds a PhD in International Trade Law from the World Trade Institute She's the former head of UNCTAD Regional Office for Africa in Addis Ababa. In fact, she's the one who established that office, and she was involved in the evolution and development of the African Continental Free Trade Area Agreement. She's a member of the World Economic Forum Global Future Council on Trade and Investment. Joy is a proud mother of 4 beautiful girls. So I am certain as you talk to her and as she interacts with you, that the one thing you will not miss is the energy of Africa, the intellectual depth of Africa, but also the hopefulness of Africa. Joy, we hand over to you to facilitate the panel discussions.
Thank you very much. Thank you very much, Brian, and good morning, good afternoon, good evening to you all, wherever you are. Thank you, Brian, for the kind introduction. So it is an honor and a privilege to moderate this panel, this session. We've heard about the framing in terms of what it is we want to do, what LEVI is, what it isn't. We've also heard about the idea that Africa is really at that point where the solutions must be homegrown. We have 90 minutes for this conversation. We're already well under that. And so I'd like to jump right into it by introducing our distinguished panel. And this distinguished panel will help us to navigate this complex terrain of how it is that we can fight the COVID-19 crisis from a health perspective. And this is not just about hospitals. This is about the entire ecosystem. And you will get the feeling of that as we start to introduce the panel. It's my pleasure to introduce Ms. Claire Kamanzi. She's the CEO of the Rwanda Development Board. She's a member of cabinet of the government of Rwanda and a founding member of the World Health Organization Foundation. We also have Dr. John Nkengasong, the czar of COVID-19 response from the African Union. He's a Cameroonian national and a leading professional with more than 20 years of experience in the US Centers of Disease Control and Prevention, where he served in the Atlanta branch as acting deputy principal director before being appointed in early 2017 as the director of the ACDC. And as you all know, he is leading and doing outstanding work with the AU COVID-19 response. We also have Dr. Julie Makani, an associate professor in Tanzania. She's a physician, scientist, and head of Department of Hematology and Blood Transfusion at the Muhimbili University of Health and Allied Sciences in Tanzania. And in this context, she helped Tanzania establish one of the world's single center study cohorts for sickle cell disease. She's a principal investigator of the Sickle Cell Pan-African Research Consortium, SPARCO, within the Sickle Cell Network. And she received the 2011 Royal Society Award, Africa Award, and is working on the application of genomic research to find a cure for sickle cell disease. Then we have Ms. Bince Gawanas. Ms. Bince Gawanas, the Undersecretary General and the advisor, the special advisor of the Secretary General of the United Nations. She's the special advisor on Africa for the Secretary General of the United Nations. And before that, she was Commissioner for Social Affairs at the African Union Commission and has held several leadership positions in her country of Namibia, including rising to Ombudsman. We also have Chief Fortune Charumbira, who is the Vice President of the Pan-African Parliament. He's the President of the Chiefs Council in Zimbabwe. He has been a member of the Pan-African Parliament since its inception and is a firm believer in African solutions for African problems. We carry on with Dr. Chika Ezianya Esiobu. Many of you would have watched her powerful YouTube TED talk where she talks about indigenous knowledge in Africa. She's a researcher, a writer, a public intellectual whose works focus on Africa's indigenous knowledge. She is the author of Indigenous Knowledge and Education in Africa. And then finally, we have Ms. Rose Sali, who is an author, editor, ghostwriter. She is the founder and managing director of Sali Publishing House, and she advocates for publication of African stories that might otherwise remain untold. She is schooled in the practices of African traditional healing. I think you'll agree with me that we have such a powerful panel to take us through this conversation. And so I will start with you, Dr. Nkengasong. COVID-19 has behaved somewhat of an enigma in Africa. Low rates at the start compared to the rest of the world, and now spiking up as the rest of the world starts to somewhat recede in infection rates. What are the plans of the Africa CDC for domestic production of medicines, for vaccines, and for critical health equipment? And can Africa get a share, a proper share in the global diagnostics market? Dr. Nkengasong, you have 7 minutes to give us your perspectives. Over to you, Dr. Nkengasong.
Thank you, Antonia. Can you hear me?
Yes, indeed.
Good. So I think, let me first of all thank the organizers for making me part of this. I'm honored to be on the panel with Bernice and my former commissioner of social affairs and all the distinguished panelists. And as we speak today, our continent has recorded 275,000 cases of confirmed COVID infections and over 7,300 deaths. So our pandemic is gaining full speed. Let me just say that we need to pause and
please unmute.
Hello?
Yes, please, carry on, Doctor.
Yeah, I was saying we need to look back and for the last 5 months and congratulate ourselves as a continent for having reacted speedily in a coordinated manner and exercise remarkable leadership in blunting the spread of the COVID-19. The state of the affairs, as you rightly characterize on the continent, is not due to chance. It's because we did certain things right, absolutely. But we should always remember that we are, this is a war. We are at war with COVID-19 and a war that we must win to survive. And that while we celebrate the past, we should really focus on the future because we are at a very different phase of the response, the pandemic, or the COVID-19 pandemic. Let me say 2 things, then I will provide a perspective to some of the questions that you raised. First is that we have to innovate ourselves out of this war. And it is a war that requires that Africa counts on its own innovative strengths in 3 areas: in the areas of diagnostics, in the areas of vaccines, and in the areas of therapy. We know that in the history of pandemics, except and until you get all 3, you cannot fight a pandemic. We cannot win a war against a pandemic, the COVID-19, as any other pandemics with just social distancing and hiding under inside our rooms and letting the virus take over our society. So I think we have to innovate in those 3 areas. The second thing, and related to the first, we must remember is that in the history of pandemics, they tend to be collapsed in global or international cooperation. And so COVID-19 is not an exception. I think we are seeing that we were literally able out of the diagnostic and commodity markets, even well-established communities like the European Union in terms of a union, just like the African Union. We saw the challenges that Italy went through even within the European Union to gain cooperation and collaboration. So this speaks to also the fact that our strategy to fight and win the COVID-19 battle has to be underpinned by 4 things. We need to cooperate more as a continent. We need to coordinate our efforts very strongly. We need to collaborate very effectively and harness all the assets that we have on the continent. And lastly, to communicate very effectively. And we are very pleased and really honored that we have 2 strong leaders at the helm of the continent providing this leadership. President Ramaphosa has done an astounding job in bringing the continent together, coordinating a meeting of head of state nearly every week to derive a strategy to fight COVID in multiple fronts. The chairperson of the African Union Commission, Chairperson Moussa Faki, has done an outstanding job in providing the support within the commission that is required. By convening, he was the first person to convene our ministers of health on February 22nd. At that time, only Egypt had recorded a case, and he brought all ministers together for us to chart a continental joint strategy and establish a task force, and he continues to be personally engaged in that. Let me just end by, to respect my 7 minutes, that we have to do 1 thing. And the one thing we need to do is to respect, to commit ourselves to what we have put forward called a partnership to accelerate COVID testing, in abbreviation PACT. The only way we have to free ourselves and win this battle is to make sure we expand testing on the continent, which is extremely limited as we speak. And it's like flying a plane without radar. And unless and until we expand that testing, we are not going to unlock ourselves from the economy safely. And I'm calling on everyone on this forum to apply themselves to this and commit the resources that they have in their own communities to support the expanded testing, followed by tracing, and then followed by treatment. Thank you.
Thank you very much. Thank you very much, Dr. Nkengasong. I think you've done an excellent job in framing what this is truly about from the perspective of homegrown solutions. We must innovate ourselves out of this war. And you mentioned 4 critical things. We must coordinate, collaborate, harness assets, communicate effectively, and also the pact on testing, the Partnership for Comprehensive Testing. This leads me to Claire Akamanzi. I think it is a good place to ask you this question about how is all of this zoning down from a country perspective? So Rwanda has demonstrated, in a sense, that Africa can on these and several other issues. And in the case of COVID-19, I'd like for you to share some perspectives with us. What have been your top 3 homegrown solutions? And how can Africa leverage this question of technology and domestic innovations to ensure effective, universal healthcare? Claire, over to you.
Thank you very much, Joy, and very good to see you and to see very many friends on the call today. So Rwanda recorded its first COVID-19 case on the 14th of March. 3 months down the road, we are counting 646 cases with 2 deaths. And we've also worked very hard to contain the spread of the disease and employed very many different strategies to do so. Like any other country, we're not prepared for COVID-19. We did not know COVID-19 was going to be knocking on our doors this year. And so it took a lot of quick actions, adaptations, trying different things in order to find a place where a solution could be found. We also organized ourselves at a very high level. Our president appointed the prime minister to chair a national task force, and I sit on that task force to meet every week. In the early days, we met every day to really see how to deal with this big thing called COVID-19, a very big threat and crisis that we're not prepared for. And so maybe just to reflect on 3 areas that we thought maybe could qualify as homegrown solutions in trying to contain the spread of COVID-19. I'll share 3 sets of these. One is we understood very early on that it's very important to educate the public and be able to change behavior, especially when it came to washing hands, because greeting, shaking hands, but most importantly, also the habit of washing hands with soap or sanitizing frequently. Now, we had to come up with a very simple tool that made it very easy to wash hands. If you go on Google, YouTube, and you search Kandagira Ukarabe, which is a tool that we use, in simple translation, it means step and wash. So we built this sink, this mobile sink that can be carried from place to place. So you don't have to have plumbing and installed infrastructure that is very expensive to use it. It's a simple sink that you step on, so you don't even have to wash, you don't even have to touch the tap or touch the soap, which again can be a risk for spreading the disease. So you step on it and then you release water when you step on it, and then it almost looks like a sewing machine. You know how you step on a sewing machine and then water comes and soap is used is released again to wash your hands. So that became a very popular tool for washing hands, very affordable, very locally made by our very, very simple entrepreneurs. And it's mobile, most importantly. You can take it from place to place. You don't have to build very big concrete infrastructure or expensive tools in order to wash your hands. So that was extremely important. And I wanted to emphasize that as an example of how we're able to instill the culture of public washing of hands, at the same time doing it safely, doing it with water, and doing it with soap, as is recommended by the World Health Organization. The second part that I want to talk about is capabilities to provide tools for people to keep safe. So we told people in Rwanda, wear masks. We told them, wash your hands. If you can't find water and soap, use alcohol-based sanitizer. These were available because in Rwanda was making masks. No company in Rwanda was making sanitizers. So how quickly could we build internal capabilities to make these tools available? It's not enough to tell people wash your hands when they can't find easy ways to do that, or you can't tell people wear masks when you don't have them to find those masks. So what we did is we mobilized all the textiles and garment companies in Rwanda. We requested them to think about a new business opportunity in making masks, especially the barrier cloth masks. We also encouraged them to look at surgical masks, and some of them were able to switch from what they were making in textiles to making masks. But some of them, and so today we actually have 76 companies that are making masks in Rwanda. And then we have 3 companies that are making surgical masks. And these have been approved by FDA Rwanda. And for them to be able to do that, some of them had to get machines from China, and government had to support them. We chartered Rwanda, our national airline, got special permission at the time of the lockdown from China, flew to China, picked these machines so these entrepreneurs can actually do the work they should be doing, which is making the surgical masks available. And so 3 companies are making surgical masks, 76 companies are making cloth masks. And then we have 1 company that is making the PPP coveralls. Again, also certified by FDA. Again, we had to support them to get equipment from China. And we have 2 companies that are making sanitizers in Rwanda. They were not making sanitizers before COVID-19. And then the last really interesting one is face shields. We have a very young company it's really a startup, Rwandan entrepreneurs who use 3D printing to make face shields. Again, this is something they learned, something they were able to adapt to very quickly, an innovation really on their part, and they make homemade Rwandan face shields that they're supplying to the medical team that are fighting COVID-19 on the ground. The last part, the third part that I want to talk about is how we are also adapting the use of IT in supporting the containment of COVID-19. One of them is drones. We used to use drones to supply medical equipment and medicine across the country and blood across the country, but we found a very useful adaptation. Again, the first commercial drone, Zipline, is an American company, but which was commercialized in Rwanda. We gave them an incubator platform where they were able to test their prototype and commercialize it with the support of government. So we're using these drones to actually enforce lockdown. So where people were still congregating in big groups, so people are not staying in their homes, the drones were used to actually take pictures, monitor, and the police and law enforcement could actually get real-time information to know where to intervene. And we found that use of drones extremely useful. The last one that I want to talk about, which is really not made in Rwanda, but adapted in Rwanda and very useful in terms of use of IT, is robots. You probably have seen some Rwandan named robots that we've been using lately for COVID-19. And these have been extremely helpful. These robots, we have 5 robots in the treatment centers for COVID-19. These robots have been extremely helpful in making sure that we relieve the medical staff to do the more important things, and the routine work is done by the robots, like screening. They can check temperature, giving medicine, being able to remind patients that it's time to take the medicine, also serving food, among many other functions that the robots could do. But most importantly, we are reducing the interaction of our medical staff with the patients of COVID-19 by using a robot, which is extremely helpful. We want to use them. They risk their lives in treating COVID-19, but we want to also keep them safe. And robots have really reduced that exposure for them, which we found extremely useful. So this is really what I wanted to share, our experience in Rwanda. And again, thank you very much for having me on this panel today. Thank you, Joy.
Thank you so much, Claire. I think therein is precisely a honing in of what it means when we say it is possible. Because I think in the African narrative, we need to reaffirm, re-stress, re-energize this idea that Africa can. We've seen innovation in the mobile sync. We've seen internal capabilities. We've seen an interesting quick dash in investing country resources to bring in technology using the national airline. We've seen adapting technology into a country context, which is this adapted in Rwanda robots. Thank you very much, Claire, for that. It's a very interesting and very sort of uplifting example of homegrown solutions. It's now time to move to Dr. Makani. Dr. Makani, you're a renowned specialist in the field of hematology, and you've done very interesting work in terms of sickle cell disease in general, and recently also linked to COVID-19. So I'd like for you to give us some perspectives on how ready we are in Africa for homegrown solutions, from where you sit from that perspective. What needs to be done to scale your initiatives? Because we're aware you've been doing several important initiatives in this area. And how can we use COVID-19 to think systemic, to think system, as opposed to disease? How do we ensure that we use it to ensure that we build resilience for pandemics in Africa? Dr. Makani.
Thank you very much. So I work on sickle cell disease, as mentioned, and today is actually World Sickle Cell Day. So it's a day that we commemorate the disease. And so it's very fitting that this webinar is on today. So a little bit about sickle cell. We have, it's one of the most common red cell genetic disorders in the world. And unfortunately, 70% of the global births occur in sub-Saharan Africa. And so from a public health perspective, Africa is the continent that has the most people with sickle cell disease, and the people in Africa have the most severe forms of the disease with a high risk of morbidity and mortality. So what we've been doing as African scientists, healthcare providers for the past 15 years is that we've been working to kind of develop very detailed descriptions of the spectrum of the disease in our countries, both at micro level and at macro level. And this is very informative because when you think about COVID-19, this is a condition where nobody anywhere in the world knew how it would present, who are the people who are more likely to have the severe forms of the disease, and what would be the appropriate interventions depending on what conditions or comorbidity that was present. So in response to the COVID-19 pandemic, the first priority that we had was to really make sure that the sickle cell patients that we already were aware of, that they had the appropriate support. A lot of the countries had gone into a lockdown. Services, rightly and for the right reasons, had really been geared towards providing and preparing the health systems for the pandemic. And so our concern was to make sure, our focus was to make sure that the sickle cell patients, when they required acute care, they were able to access that. And this is something that we were able to do. And the 4 countries that have been involved in the Sickle in Africa, which is the network that we are working in, were Ghana, Nigeria, Tanzania, and South Africa. Having said that, we have been working with other countries as well and are aware that they have put in similar strategies to try and make sure that sickle cell patients are not inadvertently adversely affected by COVID-19 pandemic. The second thing about COVID-19 and sickle cell disease is that because patients with sickle cell disease or individuals with sickle cell disease have a high risk of complications, particularly infections and particularly acute chest infections, we were very worried, and we still are very worried, that they are at high risk for COVID-19 complications. And when you look at our colleagues in the US, in the UK, and outside of Africa, they were particularly concerned, and the evidence is now slowly emerging that sickle cell patients are at risk of having severe complications from COVID-19. So we were correct in kind of being worried about that. One of the things, to answer your question as to what most countries in Africa have done, and I think this is something that is commendable, is that most countries started providing for chronic patients. So this is patients with sickle cell disease, as well as patients with other non-communicable diseases like diabetes, cancer. They made sure that if patients did not require inpatient care, they were provided with telemedicine and telehealth facilities. And one of the things, as an example, in Tanzania, we launched a 24-hour call center that provided services for COVID-19, but these are the kind of resources that once the pandemic is over, or once we're able to get on top of the pandemic, we can still use those resources for providing services for patients who are not able to come for various reasons. So I think that's something that is commendable. It's happened in Tanzania, and I think other countries have done a similar thing. The final thing that I want to talk about is research. And the particular research that I want to talk about, the first is really clinical epidemiology. One of the things that is emerging is that we don't know the epidemiology, who is affected, why they're affected, what are the outcomes, and what are the possible disease mechanisms that are involved in the cause of illness. And we in Africa, for various reasons, because of the infrastructure that we have, we are in the right position to really be able to describe very carefully the clinical epidemiology of disease. Firstly, because the number of patients that we're seeing is not as huge as the number of patients that are seen there, which means that we can, as African countries, really inform and generate knowledge that is of value, not just to African countries, but to the scientific and the global community. The second thing is in the area of genomics. And within the area of genomics, there are two areas. One is the viral genomics, and then the second one is human genomics. With regards to viral genomics, I think it's really commendable the work that has been done by 3 countries, Nigeria, Ghana, and South Africa. They were the first 3 countries, and now subsequent countries have also done the same. They were the first 3 countries that published the complete sequence of the viral genome, the COVID-19 genome in their countries. So this is work that the African Union, for instance, is working with Chris Happy in Nigeria, and H3 Africa, which is an initiative that is supporting genomic research in Africa, has been supporting some of this work in other countries. And then finally, from the perspective of human genomics, which is an area that I'm very passionate about, this is something that we need to look at. We have a population that is relatively small when you compare to the population of outside of Africa that has been affected by COVID-19, which means that we can really study and look from a human genetic perspective, what is it that has resulted in some individuals getting the infection, other individuals getting very severe forms or mild forms, and this will really, really inform the generation of intervention, whether these are vaccines, whether these are medicines, whether these are appropriate hematological or pharmacological interventions. So I'll stop there, but thank you very much for listening.
Thank you so much, Dr. Julie Makani. I think you have really carried on in the thread Claire was building, which is this idea that Africa can lead. I take very much the 3 points you've made around the focus, that sometimes it's important to focus on a particular unique situation, in this case regarding sickle cells, but also the partnerships been built, telemedicine critical, because you have reminded us that this is not just for COVID, it has a life beyond. And then the research, Africa can lead because of the realities and the contextual dynamics of where we are, lesser cases and so on and so forth. And also interesting to see how Nigeria and others are leading the way, Ghana, South Africa, on this research. So my final question in this segment goes to the Undersecretary General and the Secretary General's Special Advisor on Africa, Ms. Beyonce Gawanas. Ms. Gawanas, we're at a turning point. I think one of the things that COVID has demonstrated is that public opinion and citizens are impatient with lockdowns, impatient with when is this going to end, impatient with the reality of this changed new normal. What does it mean for lives, livelihoods, and so on and so forth? And so my question to you really is that Africa has all the policies we need across a broad range of socioeconomic determinants of health. But what must we do to get it right? And even more, what is at stake if political actors do not seize the opportunity to create homegrown solutions? Ms. Gawanas, over to you.
Thank you very much, Joy, and thank you to the colleagues for allowing me to share my views here. It's always very difficult to start talking when you have got concrete examples of what Africa is capable of doing. So maybe I should start by saying, where have we failed? What is it that we did not do that we are now able to do? So I will start by saying, we have heard about the tale of 2 cities. I want to talk about the tale of 2 health systems coexisting in our countries. The public sector, the public health system, and the private health system. And I will leave it at it because I think it speaks to itself, because that's the reality that we are still sitting with today on our continent. The second issue I want to point out is that this is the time now that we must renegotiate social contracts. Renegotiating social contracts will mean, one, let's turn election manifestos into actionable agendas that can make a difference in the lives of people. Secondly, we must empower the citizenry as they are the real accountability mechanism. We need to deal with the discontent, especially amongst our youth that are becoming impatient with bad governance, with the lack of development and the lack of adequate leadership, a leadership that sometimes do not show any empathy to the people. And that's why today we are looking at women leaders that have made a difference. And they have made a difference because they shared the pain of the people that they lead. The point that I also want to emphasize is that a lot of the pandemics that we are dealing with, be it Ebola, be it COVID-19, has got a lot to do with behavior change. And people will only change their behaviors if they have trust in those that ask them to change their behaviors. So individuals, communities, civil society organizations must have a role to play if we are successful in dealing with the issues at hand. I also want to believe that sometimes we live beyond our means. We have got white elephants. We have got donations that we accept, but these donations that we accept end up standing in our hospitals because we don't have the technical capacity or whatever to manage this. And that's why I'm saying foreign can never or rarely be translated into local realities. So what am I saying? Local is better. We have heard about the innovations, the ingenuity, the creativity, and the resourcefulness of our people. I also want to believe that necessity is the mother of invention. And if we are not going to make use of this opportunity, then we have lost it. The other issue is we have gained political independence, and we keep on talking about when is the time that we will get to economic independence. And that will only happen when we change Africa from being a mere market for foreign imports to an Africa that can actually produce. And that is where I think the director of CDC talked about. Everyone that talked before me actually talked about this particular issue. And this is where the Africa Continental Free Trade Area becomes very critical. We have got the Pharmaceutical Manufacturing Plan of Africa that is awaiting implementation on the ground. Many preventive measures recommended sometimes might not necessarily be applicable to African realities. And that is what we have learned through COVID-19, that we have to adapt. We have to reinvent. We have to do things that makes it relevant. And finally, to say that it is not just a health issue we are dealing with. We are dealing with a social issue. We are dealing with an inequality issue and access of the majority of our people to healthcare. And so it is about a comprehensive response. No more policies, no more policy frameworks. Now is the time for implementation and putting ourselves out there, and people have done that. I mean, the stories that I read about when I was researching where today there are youth out there that are repairing and upgrading ventilators, that people are teaming up to produce prototype ventilators. They are developing tools for disease prevention and surveillance. And as was said before, the drone technology that we are, today using, and so on. And just yesterday, I was watching the news, and there was a doctor speaking, and she was saying that they formed the Black Doctors of COVID-19 consortium. And what they do is, rather than waiting for people that would never have access to clinics for testing, they are going out there and actually reaching the communities that have been furthest left behind. So I just want to remind us as I conclude, what the SDG says is no one should be left behind. In Namibia, we say no one should feel left out. It's not about being left out, but feeling left out. And so I am very glad that we have this. I have got all the confidence in Africa, only if we get it right, if we can prioritize, and that we can put people at the center of what we do, because people do matter. Thank you.
Thank you so much. Thank you so much, Ms. Gawanas. I think a lot of wisdom there. Really, I think I'll do it injustice if I try to summarize, but I think I'll just pull out this idea that no one should feel left behind. When you think about the idea of the two cities, the tale of two health systems, perhaps that's where the issue is. How do we invest in a system that's for everybody? You've also said no more policies. We do have the policies. And now, as you say, we also have the AFCFTA. I think it's a good time for me to hand over back to Brian, who will then take us through the other speakers that will speak to some of the practical questions around Indigenous knowledge, traditional knowledge, and so on and so forth. Thank you very much.
Thank you, Joy. It's been a joy listening to the first speech. The focus of this conversation is, what are the solutions? Let me go to Chief Charumbira. Homegrown solutions require investment in indigenous knowledge. So what does Africa have to offer against COVID-19 in this area? How do we overcome some of the challenges related to protocols and standardization of consumer safety and protection? What role can parliamentarians and traditional leaders play in such homegrown solutions? You have 5 minutes. But if you take less, I will not complain, Chief. Chief Charumbira. Okay, whilst we wait for Chief Charumbira, I'll go to Dr. Chika Zyanya Esyobu. Chika, for all the while that I have listened to your public conversations, you are very passionate about indigenous knowledge. You are also very vocal about the value of traditional African knowledge. So, given the context of COVID-19, what can indigenous knowledge do to bolster African health systems? And if you are thinking in practical terms, what 3 actions do we need to take on this? And what kind of leadership and investment is required to achieve the sort of transformation that indigenous knowledge can bring? Chika?
Thank you, Brian. It's my delight to be here today and get to interact with you and Joy and the rest of the panelists. And of course, I see some great attendees out there. So thank you for having me. Let me start by saying that indigenous knowledge, as far as research is concerned, as far as my conviction, of course, is factored in, can be foundational in Africa's drive towards the transformation of its health sector. And beyond this sort of narrower look at the place of indigenous knowledge in Africa's health system, we also see a high probability that Africa might indeed hold the key to solutions to the health challenges that face much of humanity. And that's a bold claim, right? But let's jump straight into explanation by giving an example. And I will start with a recent research. If you will permit me to share my screen, I have a couple of pictures to display. Thank you. Okay. Yes. Okay. What we have here is the methicillin-resistant Staphylococcus aureus, MRSA. This is a dangerous variety of contagious bacterial infection that is resistant to numerous antibiotics. And antimicrobial resistance accounts for more than 700,000 deaths per year. If nothing is done, it is estimated that resistance to antibiotics can cost 10 million lives in the next 10 years and $100 trillion per year. So if that actually happens, that means COVID-19 is more like more like child's play compared to what MRSA could do to the world. So it's difficult to treat in Western nations, MRSA, and you guess even more difficult to treat in African countries. But that should not be so. That should not be the case in Africa, especially in West Africa. Why? Because for years, mucus from this West African snail that you see in front of you has been traditionally used to treat tough infections for centuries, actually, across the region. And traditional healers will use mucus from West African snail to treat tough infections, including MRSA, but medical practice, Western-based medical practice did not acknowledge that fact. But things have changed in recent times. Within the past 10 years, there's been studies done at last to validate the fact that indeed, yes, so mucus from West African snail can treat tough bacterial infections, including MRSA. Can you imagine? Doctors in West Africa watched their patients suffer for years, telling them that they could no longer be helped since their infection had become resistant to all available antibiotics, as determined by Western nations. But then now Westerners have magnanimously come to do research on this and have indeed established that it can treat MRSA. How many sufferings could have been prevented in Africa and around the world if West African medical researchers had paid attention to this centuries-old knowledge? That should bother every person of African descent. That should bother every person in the whole world. And that bothers me. And so it is not a question of just looking at Africa's health system. We're looking at the global health system. We're looking at the fact that Africa could hold the key to the challenges that plague humanity as far as health is concerned. And what is more important than health? So 3 actions we need to take on this in the interest of time. Number 1, mainstream Africa's traditional knowledge in our medical curricula at the level of teaching and research. Africa is not going to be the first continent to do that. African countries will not be the first to do that. I think of the situation in China. The very first person to establish a formal Chinese traditional orthopedic hospital studied in the United States, Harvard University. He finished his studies, moved back to China, established a faculty, and he was quick to realize that quite a few of what he learned in the United States could not apply to Chinese traditional bone setting system. So for some things, he learned that he could only operate, the surgical procedure would be the only remedy. His traditional Chinese bone setters could easily manipulate the bone back in place without cutting the patient open. And he quickly advised himself and brought in traditional bone setters into the classroom and in research faculties. And it wasn't long before China started to export much better bone treatment procedures to the whole world, including Harvard. And so that will be the first step we need to take. We need to step back and mainstream Africa's own knowledge system in curricula at all levels. The second step we need to take is the establishment of a workable and affordable clinical trial process that is suited to traditional African medicine. The regime, the intellectual property rights regime we have today, the clinical trial method that the world subscribes to today is too expensive for Africa. It is basically geared at profit for the big multinational pharmaceutical companies, and that can no longer be so. So this will need a continental world leadership initiative where Africans will need to come together and agree on clinical trial processes that will work for the continent, that is affordable, and that African researchers can easily buy into. And maybe we should sound a note of warning here. This is not a question of bringing in African pharmacologists from outside of Africa to copy and paste methods from other countries. It is a generic or organic process whereby traditional medical practitioners will be brought into the classroom, into the meeting room. Policymakers will be brought into the meeting room. Pharmaceutical companies in Africa will be brought into the meeting room. And it will be clear that this is not about profit. This is not the Western individualistic paradigm of trying to milk the masses and enrich a few to the detriment of the suffering. India did that with the HIV generic medicine. If you remember, about 20 years ago, it was so expensive to treat HIV cases across the continent of Africa, but India was quick to break away and began to produce its own generic medication. That was how many countries around the world could afford it. Otherwise, if you had left it to the global pharmaceutical company, it would still be so hard. Millions would have died as a result of HIV complications, AIDS. And so there is need for a radical approach. The drumbeat has changed, and so must the dance step, as we say in Africa. COVID-19 has shown that the West doesn't have all the answers. We would have been out of it by now. It's time for action. And that will be the last point I will make. Policy action. We really can't do without policy. There is need for policy at the national level, at the regional level, and at the continental level for progress to be achieved. Thank you, Brian.
Thank you, Chika. The drumbeat has changed, and so must the dance. Let me go straight to Ms. Rose Sally. You are engaged in the export of herbal remedies. I'm quite sure you were as excited to hear Chika talk about make her point. So what opportunities, Rose, do you see in COVID-19? And what is, in your view, the challenge in taking them further? And how would you advise African governments, policymakers, and entrepreneurs? What kind of mindset shift and what kind of policy shifts are necessary to get to the sort of change you envisage? You also have 5 minutes.
Thank you, Brian. I greet you all in the spirit of Ubuntu. You are because I am, and I am because you are. Now, as a publisher, I have learned so much from my authors. One of my authors, Titus Mafolo, in his trilogy, African Odyssey, says, Africa, if we do not tell our own stories, somebody else will, but they will not necessarily tell it kindly or even authentically. Now, that statement jolted me into focusing on publishing African narratives by Africans for Africa. One of the things we have realized from COVID-19 is that there is a vacuum, not in the knowledge. We already have the knowledge, but the challenge is that We've not documented it. And when it's documented, it is complicated. It's in theses and dissertations in universities and libraries. Maybe we need to go back to the fact that we Africans are natural storytellers. Let us pass down this information to our children, our grandchildren, in the same way it was passed down in yesteryears. Let us publish these stories. Let us put them in a way that young people, the younger generation, can understand. And let's give it to them so that they can begin to appreciate and understand that African traditional healing practices, African medicine is not synonymous with witchcraft. Now, another thing that is holding us back, Brian, is that our mindsets are still in yesteryears. We need to decolonize our minds. We need to stop thinking that, as Dr. Chika said, that answers will come from without. We need to go back to that place. And as one of my authors, Frank Orji, says in a bestseller book, no one is coming for you. Africa, no one is coming for us. We must craft our own solutions. We must find our own way out of this and out of many issues that we find ourselves in. Now, what is encouraging to me is that the African states last year ratified the African Continental Trade Area Agreement. It's supposed to come into operation 1st of July this year. But like so many treaties we have seen ratified, signed on, but they never get legs. I am urging you, I am urging us as Africans to give legs to this treaty, to relax the barriers, the tariffs, the non-tariff barriers, so that a product or a herb that grows in the Karoo in South Africa can find its way to Morocco, to Chad, to Togo, to Abuja, to Nairobi, without it being classed, because it's classified as agricultural produce, it then cannot be moved unless it's processed and marketed through Europe and then comes back to us. So processed, it literally has no value. So the key thing is for us to understand what is valuable, what is ours, and package it in a way that we can then have it across the continent. With that, I'm thinking of medicinal cannabis. We find that South Africa has decriminalized it, not made it legal. I don't believe in that language, even thinking and speaking as one of a legal background. Let us decriminalize this product. If we cannot, why have we not criminalized broccoli and cabbage and carrots? So if we do this, we will be able to also pass on the knowledge, the benefits. Our greatest resource is our knowledge. The other resource is our labor force. If we can relax our work permits, the need for resident permits, and be able to do what the East African community has done, and relax those rules for its members, then we'll be able to not only craft our solutions, but be able to borrow Rwanda's solutions and manifest them and utilize them in South Africa. And to go back to what is holding us back, our mindset. Again, we must decolonize our minds. We must release our dependence on solutions that are not ours. And as I close, I just want to emphasize that of necessity, we must create networks of the experts in Indigenous knowledge. We must have practitioners of traditional healing, as one of the panelists said, come into our classrooms, and not only at the university level, but even in the lower grades in tertiary, and begin to have this as our lifestyle and not something that is in the textbooks and on shelves in libraries. We need to go back to our garlic, to our ginger, to our lemon, to these things that give us an edge. When the pandemic happened, we were told that there'll be bodies of Africans strewn in the dusty streets of African cities and towns. That has not happened. Why? We must investigate that and not wait for someone outside our borders to tell us why that is. And having investigated it, be able to take the nuggets and the gems from that and truly utilize them in solving our problems. And as I close, I just want to say, in the words of a brilliant man, President Thabo Mbeki, I'm proud to be here. I'm proud to be, a part of this initiative, a part of what is going to happen if we pull our resources together. I am proud to be African. Thanks, Brian.
So are we, Rose, so are we. In fact, we have amazing Pan-Africanists on this panel. But I think that you underscore three important things. Number one, African traditional healing practices and medicines are not synonymous with witchcraft. Number two, as Chika had already said, hybrid solutions that look to borrowing from other cultures and civilizations, but also depending on our own homegrown knowledge in order to construct affordable, accessible, and sustainable health solutions, and indeed development solutions. And I like your bit that no one is coming for you, Africa. Don't remain a prisoner of colonial mindsets or a dependency on external help. Thank you so much. I'll check if Chief Charumbira is back on. He's not chief in the sense of, in Southern Africa, when someone is important, you call them chief. He's a real chief, as introduced by Joy. Is Chief Charumbira on? Chief, I would like you to address the issue of how do we overcome the challenges related to protocols and standardization for consumer safety and protection as we look to homegrown solutions? And what role can parliamentarians and traditional leaders play in strengthening these homegrown solutions? Chief Charumbira, you have 5 minutes.
Sorry, Brian. Chief is having connectivity problems. He just sent a message now to say that he's hearing everything, but we can't hear him. So I'll keep on monitoring and send you messages as and when he gets connectivity.
Thank you, Lynn. I think that Chief is as we said, is the acting president of the Pan-African Parliament and also the vice president of the parliament. I think this takes us to opening up the floor, and let me call back my able co-facilitator, Joy. Joy, it will be a joy to have you back.
Thank you very much indeed, Brian. Great perspectives from that set of our conversation. Lots of interest in the panel, lots of interest in the chat in terms of questions, and also some that we had received before. So perhaps I will go to those first. And this is a question from Mr. Mugwaneza Olivier. He says African homegrown solutions have been several and impactful in many countries. He gives examples of the Gacaca courts in Rwanda, which helped with the healing after the genocide. He gives another example of Girinka, and so on and so forth. And he says these solutions have acceptability and local applicability, but no international recognition. Now, Claire, I'd like to put you on the spot and ask this question. How do you scale from some of the solutions you've had locally to take them internationally? Even if we were to say, let's get out of Rwanda and scale to Africa, for example, how do we solve this recognition problem? That's a question for Claire. I'll ask a few before we proceed. The second question comes in from Letty Tembo Longwe. She's the interim director and head of the Tana Forum. She asks a question really about this idea of how do you scale homegrown solutions? Have there been any clinical results from the Madagascar coronavirus herbal mix? And if so, what can be shared? Dr. Nkengasong, what are we doing with Africa's innovation coming out of Madagascar? A similar question in that thread, another example that comes from the chat is about the Senegal test. Ugon Makoki says Senegal has developed this powerful test for COVID-19. Why are we not expanding it across the continent? Dr. Nkengasong, for you to please share some reflections. And then the last question I'd say is to Dr. Makani, coming from the chat, from Lexon Makavi, who says herd immunity. what are the chances for herd immunity as a solution? So let's start with Claire, move on to Dr. Nkengasong, and then to Dr. Julie, and then we take some more questions. Claire, over to you.
Thank you very much, Joy, and thank you very much to all the participants for the comments and the questions. It's really, really interesting to hear from all of you and also the other panelists. Now, for homegrown solutions, how do we give them that international appeal and also application? I think three things that we have to keep doing. One of them is, as much as possible, document some of the homegrown solutions that each country comes up with. To the extent that we can share that in terms of documenting, publishing, and where even possible, registering intellectual property for those specific homegrown solutions where applicable. So I think documenting is the first thing we really need to do better. The second one is sharing experiences. In other examples of homegrown solutions we've had in Rwanda, like Gachacha, that the person who asked the question referred to, we've had many sharing of experiences with other countries that come to Rwanda or Rwandans participating in panelists. It's really about sharing experiences so people can see what is replicable somewhere else. So that's really important. The last one, which I really want to talk about, and maybe Dr. John Nkengasong might also want to talk about that, is that for this COVID-19, a very interesting collaboration happened at the AU level. So we had the chairperson of the African Union, President Ramaphosa, appoint different special envoys for different purposes. One of the people that he appointed was Mr. Strive Masiyiwa to support the African countries with procurement of supplies that are needed for COVID-19. And I know he's worked very, very closely with the CDC, and Rwanda has been participating in that as well very closely, our president, myself as well. And one of the platforms that he's building together with CDC is an IT online procurement platform where African countries can come together and bulk purchase and negotiate good prices because of economies of scale, which is good. But the other good part about that is also putting on the platform products that African entrepreneurs are making that are relevant for COVID-19, whether it's masks or PPEs or ventilators or test kits. Whatever African innovations are coming out, this platform is also going to enable them to put them on the market so other countries can use them and buy them as well. So I think this is a really interesting development. And on the Rwandan part, we're working with our entrepreneurs to see if they can put some of their products on this platform and sell them to the rest of the continent. So that's really how I see us sharing and also scaling up some of the innovations that are coming across the continent. Thank you again to everybody participating today.
Thank you, Claire. Thank you very much. Dr. Nkengasong, over to you.
So if someone can, okay, good, it's good. So I think, by the way, thanks again for pulling all of us together. I think Claire and I have exchanged plenty of emails during the very early days of the COVID introduction on the continent, especially with respect to supporting member states with diagnostics. And through this media, I'm able to match the name with the face. I mean, congratulations, Claire, for the good work you all are doing in Rwanda in keeping down your pandemic at a very controlled level. So let me just comment on the two things you touch on, which is the diagnostics in Senegal and the remedy in Madagascar. I would say that we, as a continent, as we innovate and as our solutions, we have to also make sure that there's quality at the center of it and that it is as competitive as elsewhere. And I think those are the two things that will bring us respect and in a very competitive manner. The diagnostics in Senegal, we as Africa CDC are at the center of all countries trying to develop diagnostics. It's not only Senegal. You have Morocco also developing a test. and Kenya, Kemri, also developing a test. We are in very close contact with these 3 countries. And the process, the way it works is that when these countries will develop it, we as the Africa CDC will take a look at that, independently do our validations and make sure that we put a stamp of approval or endorsement that speaks to the performance in terms of the sensitivity and specificity. The test in Senegal, I must say that is still a prototype test. The Pasteur Institute is a great institution, but I think the media went a little bit ahead of themselves to announcing that it's a $1 diagnostic test. I think it's a prototype, and we remain hopeful and waiting for the Pasteur Institute to make available that test so that we can work with them very closely to validate it and put the results out there. I think we have to follow the process, the procedure, and not jump ahead of ourselves in as much as we want to promote innovation. With respect to the COVID-19 organic in Madagascar, we are in very close contact with the government of Madagascar. As a matter of fact, just last week, the government shared with us all the details about the remedy, which we are reviewing. And we have promised them that next Monday, we'll send them a formal reply suggesting the way forward. And the way forward in terms of looking at it in a very holistic manner and saying, look, we've reviewed the data you submitted very carefully. And secondly, if there are any gaps, we will be happy to work with you to fulfill that gap so that when we put out our story out there as a continent, it's a strong story and it's a credible story and it stands on strong scientific ground. So I think we are not discounting that. I think we are very excited with the prospect that we will be working with the government of Madagascar. And this applies to any other remedies that are being reported on the continent. And this is not new. When HIV started in the early 80s, there were so many claims around HIV treatment. And we have to be very cautious that in as much as we want to promote and have to promote our own indigenous solutions and innovations, let them go through the rigor of science. Science is universal. I think the principles of science are universal, and that has to be the cornerstone of our innovation. Thank you.
Thank you very much, Dr. Nkengasong. Now, Dr. Makani, herd immunity. Is it a solution?
Thank you very much. So this is a really interesting question. And I think the answer to the question is that we do not know. In that when you look at the evidence, it's rapidly evolving. And a very good example is the whole issue about hydroxychloroquine and how the results have had, the evidence that was published had to be retracted from the scientific journals. So I think we have to be very aware that the evidence is rapidly evolving, and a big part of that is contributed to the absence of data, adequate data, or access to the data and absence of data. And one of the things that we are all very much aware of is that in most African countries, there is an element of inadequate testing, and therefore an element of inadequate information about the magnitude of infection. So I think that will very much inform what we know about immunity in general. The other thing with regards to that is that we know to a certain extent that there is asymptomatic infection, and there are also individuals who have mild disease who are also very much infectious. I think one of the things that we haven't talked about here, just because of time, is the whole issue, which is very interesting, of those who had severe COVID-19 infection and whether their plasma could be potentially used as treatment. And I think some of you may have been aware of trials of using convalescent plasma for treatment. And the caveat to that is that convalescent plasma requires people to have severe COVID-19 in order for them to generate adequate antibodies that would potentially be therapeutic. But again, the evidence for this is not really adequate. I think the final thing with regards to the immunity question is with regards to reinfection. So far from the evidence that is available, there are limited reports about reinfection for those who've already been infected. But again, this is a new area, and I think we just have to be cognizant of the fact that very few people know. Having said that, this is where we as Africa have a fantastic opportunity, because we can answer all these questions very, very quickly. We can really screen patients, whether it's blood donors, screen populations very quickly, and we've got the infrastructure in place. We don't have the issues around health insurance or issues around health systems. We have community health workers, we have populations that are available. So it means that we could rapidly, with the right tests, we can rapidly screen populations and specific populations and say, have you been infected, without you realizing it, and then start asking questions retrospectively. So we've missed the opportunity to do prospective research, but we do have a fantastic opportunity for doing retrospective studies that will then inform how we proceed. Thank you.
Thank you very much, Dr. Makani, for those perspectives. I'm sure that Dr. Nkengasong has taken note of this plasma angle, utilizing plasma. An interesting comment from the chat talking about the danger of gifts and how it conveys the wrong message to our youth. I mean, of course, many important gifts have been given to Africa, but of course, one always asks the question, what it means for productive capacity, what it means for the footprint that we are seeing coming out of Africa in terms of face masks, all the examples Claire gave. What do gifts do in that context? There is a layer also around the right trade policy, which is this question of how do you ensure that what we're seeing as African production that has come to the fore remains as the lockdowns ease. We must ensure that we find ways and means to nurture, flourish African innovation. There's an elephant in the room that I'll draw to Chika before we come for a parting shot. Chika, very quickly in 2 minutes. Intellectual property rights. Everybody has spoken about the innovations and the inventions and the production and so on and so forth. You also gave examples of traditional knowledge. But it's also possible that these names, these processes, someone has bit us to the global registry of intellectual property. How do we resolve this question? Dr. Chika.
Thank you, Joy. And thank you to all the panelists so far and the attendees. I kind of had a quick minute to read through the chat, and I see some really brilliant and interesting interventions and questions. I had mentioned intellectual property rights during my brief presentation, because yes, it is an elephant in the room right now, and always an elephant in the room when you discuss Africa's indigenous knowledge. And I think the consensus right now is that the Western intellectual property rights regime cannot effectively capture what intellectual property rights mean to Africans. And so in the West, we see it as this highly individualized, again, I think I made reference to that earlier, profit-driven, personal approach to knowledge ownership. In Africa, it's more community-based, where you approach a community, and within that community, there is knowledge about herbs, of how things are done. For the most part, of course, there are instances where herbal practitioners kind of hoard knowledge, keep this knowledge to themselves, and only make it available through a certified process of probably apprenticeship or some form of exchange of medicinal knowledge that is acceptable within community. And so there's been calls for a completely new model, a completely new approach to intellectual property rights ownership as far as African traditional knowledge is concerned. And that is important. Remember that the present regime of IPR was fashioned by the West at some point in history when it suited them. When you think of copyright, you think of trademarks, you think of geographical indication, all of that had come in at a time when people sat together and felt in the Western world and felt that was what would work for that world and that locale at that time. But as Africans come of age and as we see a uniqueness in our own intellectual property rights, it's time to go back to the drawing board and sit down and look at a kind of it's called a sui generis kind of approach, a completely novel approach to intellectual property rights protection that will protect communities, that will not be so profit motivated, but look at how communities can advance, with knowledge available within these communities. And just finally, it has to be a continental-wide approach. This cannot work as at the national level or at the regional level. Africa has to come together to establish this and build it and grow, work on it together. Thank you, Joy. Thank you
so much. Thank you, Dr. Chika. As you said, back to the drawing board, continental, great opportunity, because phase 2 of the AFCFTA will also require negotiations on a continental sort of intellectual property rights regime. We have 4 minutes to the end. I'd like to beg your indulgence that we have another 10 minutes, please, to lock this up nicely. And in order to lead up to the invitation to our host also, I would like to give each panelist 1 minute to give us your parting shot. If the question was, what is that one must have to ensure we have homegrown solutions? In just 1 minute, each of the panelists, your parting shot. Let us start with Dr. Julie. Dr. Julie? Otherwise, we could start with Dr. Nkengasong, who's with us already. Dr. Nkengasong, your parting shot. What is that one thing we must do? Please unmute. Unmute. Okay, there seems to be, yeah, please, your parting shot, Dr. Nkengasong.
We have to find our solutions to resolve this battle. And the victory will be continental, but the battles must be won locally. Thank you.
Thank you very much. Very precise. Let's carry on in that spirit and that trend. Claire, parting shot. What do we do? What is that one thing we must do?
Okay, so looks like my video isn't working, but I think that we should not waste this crisis. I think there's a lot we can learn from this crisis that should leave us better off having gone through it. And I think that for innovations or homegrown solutions to thrive, the role of the public sector cannot be underestimated. I think governments must come very strong in supporting and nurturing these solutions so that they can go to market sooner. Thank you.
Thank you very much, Claire. Don't waste a crisis. Government support, go to market scale. Ms. Rose Sali, your one parting shot. Ms. Rose Sali.
Thanks, Joy. For me, it's really that we must make the knowledge available starting from the very young people. Like I said, it's important that our children understand that African tradition, culture, healing methods are not synonymous with witchcraft. They are valuable. They are our greatest asset. Thank you.
Great. Catch them young. Catch them young. Dr. Julie Makani, your parting shot.
Thank you, Joy. So I have two, not one. My parting shots. The first is really, we have a fantastic resource in Africa in terms of fantastic scientists, fantastic spectrum of disease that we can utilize to generate knowledge that would be locally applicable and improve health, but also globally relevant. So, and then the second thing is really making sure that with all the solutions and all the interventions and responses for COVID-19, we have got to integrate research into this, because the research in our setting is what would inform locally appropriate interventions and solutions. So thank you.
Thank you very much. Great, great, great. Dr. Chika, we go to you before we close off with the USG. Dr. Chika, your parting shot. Unmute, please.
Maybe I should just say that science is not universal. Knowledge is not universal. I refer whoever wants to know more to Thomas Kuhn's 1962 classic, the structure of the scientific revolution. So if you are ever in doubt about the production of knowledge, the biases behind knowledge, the power structure behind what is acceptable as science and as knowledge, please read the 1962 book by a Westerner, Thomas Kuhn, The Structure of the Scientific Revolution. And there are so many other books to back that up. And because, and if we come to that realization in Africa, which is what we lack at this time, we still think science is universal, that once it comes from the West, then we should just build on it. And that is, that has been proven to be false. If we come to that realization.
Please unmute, Abu, please unmute Dr. Chika so she finishes her idea. Dr. Chika, you're muted.
Thank you. If we come to that realization that science is not universal, as has been proven by several scientists and publications, that knowledge is not universal, then we will have the confidence as Africans to develop our scientific processes, to build our own knowledge systems, and to validate such and use that to advance the continent and the rest of the world.
Thank you very much. Thank you so much, Dr. Chika. Ms. Bins Gawanas, USG, please, your parting shot before we go to Ahuna.
Thank you. I will basically sum up the parting shots of the others, and I will say, be proudly African. Believe in our own intellect and capacity, and write our own narratives. Thank you.
Powerful, powerful. I don't know if the chief is with us. He had some issues before. If so, jump on quickly. Otherwise, it is my pleasure to introduce our host, Ms. Ahuna Eziakonwa, the Assistant Administrator at UNDP and the Director for the Regional Bureau for Africa. Ahuna, over to you to give us your closing remarks and a vote of thanks.
Thank you, Joy. I hope everyone can hear me. What an exciting 90 minutes it's been talking about a topic that is really close to my heart. I want to start by really thanking the panelists for being not just thought leaders on the continent, but global thought leaders. I think that's what first thing that's come through to me is that all the people we assembled for this topic today demonstrate one thing, that they are global leaders. And you really have made us proud as we discuss this topic. Secondly, you all put the sort of magic word on each of the statements that you made. From Claire Kamanzi, we heard that states matter, that it's really important to establish states that are capable, competent, confident, and that are compassionate, that care for their people. And this is, if there's anything that we take away from COVID-19, it is that we cannot bypass the state, that leadership at the level of the public sector has to be strong to direct the people. And states that are also innovative. We see all the innovations that came from that. From Dr. John Kensango, we hear that regional institutions matter, and continental leadership is vital for the new normal, for the new world that we're going to enter into, because from there comes good direction, good leadership, good solidarity that cross borders, because these crises know no borders. So it's very important to have that accent on regional institutions. From Professor Julie Makani, we hear that research and science matters, and not just looking at, I was very struck by this discussion on how Africa can take advantage of the fact that the spread of the disease lagged on the continent. We have smaller numbers to manage, and therefore we have a bit more thinking space to then influence the world. you know, that Africa right now looking not just inwards at its own needs and challenges, but that it can actually have the key to the solutions. We heard this from Dr. Chika as well, that Africa could hold the key. You know, this is a continent that's shaped like a question mark, and COVID-19 is emphasizing and revealing, laying bare the fact that the solution can come, the answer can come from Africa. And all the deliveries today validated that. And from Rose, Sally, we heard that it's important to tell your own story. You have to be responsible for telling your own story and controlling your narrative. And it's really heartwarming to see that we have writers and academics who are starting to tell those stories. From Dr. Chika, we heard that traditional medicine should not just sit in you know, juju houses, as some people would like to call it. They need to be brought into the classroom, modernized and adapted, because they are relevant for humanity in Africa and humanity elsewhere. And from Beans Gawana's Undersecretary General, we heard about the tale of two cities and the tale of two health systems that must be dismantled and brought into one ecosystem of support for humanity and public goods. And I want to maybe sort of sum it up with what Brian said earlier, picking up from some of the panelists, that the drumbeat has changed, and so must the dance. The drumbeat has changed, and so must the dance. A lot of people talked about mindset shifts. This inaugural conversation on homegrown approaches, which the Leadership and Values Initiative is championing through the World Economic Forum, is really about announcing this new drumbeat on the continent of Africa, an Africa that is much more confident, that's got the answer, and that must celebrate it. So let's go and beat the drum even louder. I think that's what's needed. We've seen today that some of the examples we saw coming out of the country, some people didn't even know about it. We're announcing it. We're going to be using this platform to continue to celebrate these homegrown solutions and the credibility that they bring to the continent. And let me end, Joy, by saying thank you to you and to Brian for leading this so gracefully and taking us through a really exciting 90 minutes on this topic. And I also want to thank our panelists. As I said, you're global thought leaders, and we're extremely proud of you, and you've made us proud, and we want to encourage you to continue to shine. This will not be the last conversation we have with you, because this is a story that we're making, a story in the making, and you are part of the various chapters. I also want to thank our teams on the LEVI side and UNDP side who did all the background work to make this a reality. To be continued. Thank you all very much, and see you at the next station when we have the second round of dialogue on homegrown solutions. Over back to you.
Thank you, thank you, thank you very much. Thank you. We've come to the end. We've come to the end of our session. Thank you for joining us, and have a good day. Goodbye.